Today is April 10th, 2013, and Danielle Beckwith, Megan Parks are here for the Why Play, Why Not interview with Julie Shackley, President and CEO of Androscoggin Home Care and Hospice. And we have a series of questions that we're going to be asking.
Great.
What does Androscoggin Home Care and Hospice do, and why do you do it?
Well, Androscoggin Home Care and Hospice delivers or provides services to patients in their home primarily. Those individuals, those who come out of the hospital requiring who have had hip replacements or medication administration, cardiac issues, those types of things. And we have nurses, physical therapists, occupational therapists, speech therapists, social workers that can go into the patient's home and help them improve their outcomes so that they can be independent again. We also have our hospice program, which is for care delivery for end-of-life care. And we also have the first inpatient hospice facility in the state of Maine, which is in Auburn, and it's a 14-bed acute care hospice inpatient facility for those individuals who really need that added support for pain and symptom management, and they're unable to get that in the home because you're going to have an intensive physician and nursing involvement at the hospice house. So we deliver home care and hospice primarily in patients' homes, but we also see patients in nursing facilities, assisted living facilities, wherever the individual's home is, we see them. And so that's a short version of what we do.
Great. And how did Androscoggin Home Care and Hospice get started, and how long have you been offering services?
Right. Well, we have been around for about 66 years. It was actually, to be more precise, 1966 when when it originated. Actually, a group of community members saw a need in the community to have individuals be able to provide nursing services in patients' home. And so a group of community members actually developed this organization as a nonprofit. And then later on down the line, we became Medicare certified. We became Joint Commission accredited, so from a quality standpoint, so that we are seen as the organization is seen as one that's delivering high quality care. So it originated with just a group of community members seeing a need and developing it at that point.
Oh. And how did you, Julie, get involved, and why did you choose to get involved with Home Care and Hospice?
Well, I'm a registered nurse, so I've been in nursing for over 30 years, and I started at the hospital, like many nurses do, and that definitely gave me a lot of knowledge and expertise. I went into home care because I felt that that was really the place where individuals really wanted to be when they were sick. I wanted to be in their own home, in their own bed, surrounded by their family and friends. And so I went into home care and was a nurse in the home care world for a while and really enjoyed that. But I found myself looking to broaden, looking at visionary things, problem solving. I assisted people with their clinical issues, their management issues, and found my way getting into the management world. And then later on, what I ended up doing is becoming a clinical supervisor of a team of nurses and therapists and home health aides in home care, and really enjoyed that thoroughly. Decided to go for a master's degree and became I obtained my master's at USM, actually, and my bachelor's was at USM also. I'm a Mainer, and really in management, in nursing management, and that really has helped me broaden my, again, my skill sets, my expertise. And when I came here to Androscoggin Home Care and Hospice, I was a clinical supervisor, and really enjoyed that, but I'm somebody who needs to learn and always kind of stretch a little bit. So I've been there, done that, so wanted to expand my horizons a little bit and went to another organization, but as a hospice program director. So I added new skill sets, added a wealth of knowledge in regards to community speaking, presentations, budgets, those types of things. Like many nonprofits, world changes, not always in our favor. So the job changed. I decided that that wasn't the right fit for me and came back to Androscoggin Home Care and Hospice. And I became the director of the Performance Improvement and Staff Development Department. Had a lot of fun doing some teaching, doing quality work. Again, was seen as kind of that go-to person to help problem solve between different programs. So was promoted to Chief Operating Officer, and then the Executive Director left. So I was interim for about 9 months, and I really enjoyed that. Loved working with the community, loved working with the community board, and put my hat in the ring. And then fortunately, after a national search, they selected me as the next the next CEO, and I've been here about 8 years in this position at this point. So,
wow, congratulations.
Yeah, thank you.
That's a lot.
And I still feel that home care is the right place to be. I think community-based care in general is going to be something that's going to continue to expand over the years, because it really is where patients want to be taken care of, but it is very cost effective. It's one of the most cost effective locations to care for individuals, and the quality, our quality indicators are extremely high.
Right.
So from the new healthcare reform world, it definitely, home care and hospice in patients' homes is really the way that I think our future is going to be going.
I agree. I really do. Well, you've already touched on some of this a little bit, but what challenges does Androscoggin Home Care and Hospice face the Lewiston Auburn area from an organization's perspective?
Well, from an organization's perspective, and I got to start macro, the reimbursement world is becoming much more challenging, and primarily our patients are, though we care for maternal child health, so pregnant moms and infants all the way up to 100 years old, the majority of our patients and consumers are 65 and older. So we get most of our revenue from the federal government, Medicare. And with the decreasing cuts, we're struggling. So since 2009 to 2017, we'll be losing about 3 to 4% each and every year for reimbursement. And so that is going to be more and more of a challenge in order to continue to meet the nonprofit mission, which we care for those who don't have insurance, those who are underinsured, and that's going to impact the communities that we care for. So that's really been our main challenge, and will continue to be, is trying to figure out how to do more with less. And you've probably heard that throughout the community because of the economy and those types of things. We've had the added burden in regards to the reimbursement decreasing over the years too. So fortunately, we have a wonderful group of community folks and individuals, board members, volunteers that all support this organization so that we can continue to deliver that mission. So there's volunteers to help do work at, not really work, but they help us manage the hospice house. They go into patients' home to help with grocery shopping. The board of directors and many community members serve on several committees that help us fundraise so that we can gather more finances to help offset the losses that we've had.
So funding.
So funding, yeah. Unfortunately, that is going to be the challenge, I think, for all of healthcare. Because the Patient Care Affordability Care Act, for us, that cut us, and the hospitals are in a similar challenge too.
What are Androscoggin Home Care and Hospice current needs and wants? That's along the same lines also.
I think, well, right now we do need to, because we're going to be having considerable cuts, we really needed to develop our community outreach in regards to having folks help us with that fundraising and really making sure that we will have enough funds to care for those in need who don't have insurance and underinsured, really critical. because there are more and more at this point because of the economy. So that really has been a need that we've been working on for several years because we've seen this coming. So we've prepared ourselves and done a lot of work there. So certainly involvement in this organization from a financial support is always welcome, though we have over 250 volunteers that assist us in our community. I explained a little bit already in regards to some volunteers help us with grocery shopping, some volunteers help us in the office by answering phones, by stuffing envelopes, by doing those types of things at the hospice house. So getting involved in regards to supporting patients either at the home or going out playing cards with patients. Sometimes that's all that needs, that we're the only people that the elders may see. And so it's important to have volunteers that are willing to go into patients' homes, to do grocery shopping, those types of things. But also serve on our committees. We have a board, a volunteer board, community-based, board, and there's 16 members, and we cover such a vast area, not just the Lewiston, Auburn, or Androscoggin, but also Oxford County, Franklin County, and then we're on the periphery in northern Cumberland County, Saginaw, and down in Thompson and Brunswick area too. So we try to have a diverse group of individuals serving on our board of directors, but just that is always a welcome to have folks that are either new or have been in the business. You don't have to be in healthcare to serve on a healthcare nonprofit board. In fact, sometimes it's more helpful if you don't have that, because you come from exactly an outside perspective that you know. So there's many different ways that we can get support, or we can many different needs that we have, but some can be easily solved by more volunteers in the community supporting us, not just with their funding, but with their time and their talent. So.
Oh, and that answered the next two questions. So, are you currently looking for board members or committee members?
Committee members always. We have foundation committee. We have a professional advisory committee, which really is a good one to start on, because that really looks at our operations, and so they talk about ethical dilemmas, they talk about case studies, they talk about certain clinical policies, but again, you don't need to be a clinician to serve on that. We have outside community members serve on that. We do have a physician or two serve on that, but really it's that outside perspective, making sure we're thinking about the patient first. And we're always thinking about that. So that is a great committee to get involved with. Meets quarterly. Many of the committees meet quarterly. So we have the foundation, we have the professional advisory committee, we have just the volunteer committee, we have events committees that you can be involved with, but you don't really need to come to any other meetings except for those event committees. So there's many, many different ways, depending on your time, your energy, and your interest, on how you can get involved. And what we'd ideally, just give us a call, and we would probably have you speak with our volunteer coordinator, supervisor, to get an idea in regards to what types of committees and needs are available within the community, within the organization.
All right, great. That concludes our interview.
Thank you very much.
Thank you.